Welcome. Welcome to Consumers Doctors Live. This is Dr. Bengala. Today's topic. Thank you for joining the channel. Today's topic is one of the stakeholders. There are 5 stakeholders, like in the healthcare. Consumers are number one. I've been talking about consumers a lot. Doctors, hospitals, insurance companies, and so-called insurance brokers. These are the 5 stakeholders. Let me focus on the hospitals. Lately, I've been hearing a lot on hospital acquisitions of doctors, medical groups. That's a step in the wrong direction. You may ask me why. I'll tell you why. Future healthcare is not in the hands of the hospitals or doctors or insurers. It is in the hands of the consumer. Yes, we need to stop this consolidation process. It is a wrong trend. We need to focus on consumers, how to provide the health care at a reasonable cost. Right now, hospitals are failing, yes. Buying medical groups and individual practices doesn't make any sense, folks. It doesn't make any sense. Everybody is becoming greedy, greedy. Even the hospitals, they want a total control on the consumers, which is not going to happen. I'm telling you, it's not going to happen either in my lifetime or future. The more and more the technology comes in, consumers are empowered. No matter what government does, no matter what other entities do, consumers will take over the healthcare. So hospitals buying these individual practices is a losing proposition, losing, yes. Instead, focus on efficient delivery of care. With COVID right now, telemedicine, telehealth, the technology is changing so rapidly with portable devices, portable ultrasounds, capsule endoscopy, you name it, folks. There's so much going on and automation. The hospital's focus should be on technology, not on acquisition of medical practices. I believe hospitals should embrace families as caregivers, not employing nurses in the hospitals. I believe we can lower the cost if you let families could be caregivers by the bedside. And anytime there is a need for it, ideally, the point of care should be home, folks. Point of care, I believe the point of care is going to be home, not in the hospitals. So I foresee a change in healthcare. The point of care will be right at home with all the technology, all the telemedicine, telehealth. Very rarely, if a person needs an intensive care, even in the intensive care, you need to let families be the caregivers so you can cut down the cost of the healthcare. That's the focus should be, not on buying medical groups, buying physicians. That's a wrong step in the wrong direction, folks. If hospitals are listening to this, they need to focus on transparency, affordability, and mostly competition, folks. Doctors and healthcare professionals will love to compete. They're unique animals, man. Doctors are unique. They will want to compete. Not like other professionals. Doctors in general want to compete. You cannot take away their competitive spirit. I would encourage healthcare professionals to be in that and focus on healthcare delivery, where you can provide the best healthcare right at home. So point of care is going to be changed, folks. It's not the hospital. And the hospitals need to be more transparent. Once I check into the hospital, once I check out, I need to see my bill. Man, I need to see my bill. Before even they send it to the insurance companies, I need to sign off. That's the transparency I need in healthcare. When I walk into the emergency room, they need to tell me how much it is before you even check in. Don't even bother asking, do you have insurance that you don't have? How are you going to pay for it? Very first thing you should ask, how are you going to pay for it? Rather than, you have insurance? That's an old trend, folks. Things are going to change. If you do like this channel, subscribe, share, make some comments. I would love to hear from you guys. I love, especially people who really need the care the most. They're the one who need help. I think we can all focus on helping the people who cannot pay for the health care, who cannot take care of themselves, and physically impaired. Those are the folks we need to focus on, and how we can provide the best health care. They need the best health care more than regular folks like us. Again, if you do like this channel, subscribe, share, make some comments, and come back. Watch me on Consumers Doctors channel. Goodbye. God bless.